So when we describe hormones and hormone replacement therapy, we're really describing estrogen, progesterone, and testosterone.
Yep.
Correct?
Yep.
And these are naturally occurring hormones that we have, and they start to decline as we get older during what we call this phase, which is perimenopause.
So why don't enough clinicians prescribe testosterone? This is an educational system failure. And the reason that we have this failure is because the Women's Health Initiative came out in 2002. And this is when the study closed, and it scared a lot of people from prescribing and taking menopausal hormone therapy and led to an absolute extinction of training.
For decades, hormone replacement therapy, or HRT, was a lifeline women used to reclaim their energy, sleep soundly, and live joyfully, free from the torment of menopause. Then 2002 happened. A major clinical trial called the Women's Health Initiative dropped a bombshell. The FDA responded with its harshest warning label, and just like that, hope turned into fear. Millions of women abandoned HRT practically overnight. And here's the twist. Everything the world believed about HRT was based on a flawed study. And in 2025, the truth finally came out. Now it's time you got the full picture.
And I think the studies began in the late 90s, when they actually started giving them the hormones versus placebo. And what they found was, in this particular population, the women who were given estrogen plus progesterone had a relative risk increase of breast cancer of about 25%. So they just, the authors got together, some of the authors, not even all of them, got together and decided to halt the study. They held a press conference at the Watergate Hotel in the ballroom, invited every national news outlet. This is before social media, right? So this is in 2002, and said, estrogen causes breast cancer. All of the authors didn't even have a chance to review the data. The doctor, like we were getting phone calls like, oh my God, what's going on? Because ABC News, NBC News, this was the biggest health report in 2002. It was the number one news story for health. And the headline screamed, estrogen causes breast cancer.
So what actually happened to cause this massive panic? Results from a landmark study by the Women's Health Initiative came out, and it hit the medical world like a bombshell. The findings were alarming. The study suggested that a combination of estrogen and progestin increased the risk of breast cancer, coronary heart disease, strokes, and dangerous blood clots. The medical community didn't wait. Doctors decided the risks outweighed the benefits, and they stopped prescribing HRT altogether. And just like that, it was over. But here's the question nobody was asking at the time. What if they were testing the wrong women at the time? In fact, the FDA now admits the 2002 findings were deeply flawed. Here's why. The average age of women in that original trial was 63 years old. Most of them were more than a decade past the onset of menopause. They were much older, many who carried other age-related health risks. This completely skewed the results. On top of that, the study used synthetic hormones derived from pregnant mares' urine. This is completely different from today's HRT, which is bioidentical and gets absorbed directly through the skin, significantly lowering the risk of blood clots. This can include patches, gels, spray, and creams or lotions. Today, the medical community's view has shifted. According to the National Institutes of Health, hormone therapy remains the most effective treatment for common menopausal symptoms and can help protect against bone loss and osteoporosis. For most healthy women under 60 or within 10 years of menopause, experts now agree that the benefits often outweigh the risks when treatment is appropriately prescribed and monitored. Now, the ultimate vindication has arrived. In November 2025, the FDA finally removed the terrifying black box warning label from HRT medications, making it official in February of 2026. And many women health experts have come out to advocate for HRT due to the loads of health benefits it provides for menopausal women.
But this one is a huge one. They have all seen their parents struggle with cognitive decline, Alzheimer's, and dementia, something I actually am going through in my own life.
Oh, so terrible.
And
I'm sorry for that.
Yeah.
Yeah.
And they look at their parents and they think to themselves, because women are more affected than men, and they think to themselves like, there has to be, like, what is happening here? There has to be something better. And then, because women are smart and inquisitive and curious, they will do some research, and it's not that far of a stretch to think that estrogen started at the time of menopause. It's good for your body, it's good for your heart, it helps you live longer, it's good for your pelvis, it's probably good for your brain too.
Did you know that nearly 2/3 of all Americans living with Alzheimer's are women, according to the Alzheimer's Association? For decades, we assumed women faced higher risks simply because they lived longer, but groundbreaking science points directly to estrogen loss. So estrogen isn't just a reproductive hormone, it is a vital shield for your mind. Leading neurological studies show that estrogen keeps brain cells healthy, maintains healthy blood flow, and shields the brain from inflammation. When menopause wipes out your estrogen supply, your brain loses its main protector right as natural aging speeds up, leaving it highly vulnerable to damage. But the danger of losing estrogen doesn't just stop at your mind, it also directly targets your heart. Estrogen acts as a natural relaxant for your blood vessels, keeping them flexible and clear. When menopause starves your body of this hormone, your arteries can stiffen, allowing plaque to build up quickly. A WISE study by the American Heart Association revealed that a staggering 69% of young women dealing with coronary artery disease had abnormally low estrogen levels, compared to only 29% of women with healthy hearts. This proves that a lack of estrogen severely worsens heart disease, but by using HRT, it stimulates the release of nitric oxide, a natural compound that helps blood vessels relax and arteries dilate, improving blood flow and actively supporting heart health. Beyond your brain and your heart, your bones are another part of your body that estrogen deprivation targets. Here's a simple explanation why. Estrogen acts like a master builder, constantly telling your body to lock in calcium and keep your skeleton strong. When menopause suddenly cuts off that supply, the destruction cells take over, causing your bone density to plummet.
Let's talk about loss of bone. Perhaps the most common and known consequence of losing estrogen is osteoporosis. 200 million women in the world have osteoporosis or weak bones. How do we know if our bones are getting weak? Well, the first thing you can do without even going and having a test is to ask yourself, is your mother shrinking? Or am I shrinking? Did I used to be 5'4" and now I'm 5'2"? That is due to the compression of our bones. That is a known risk factor, is familial history of osteoporosis.
Data from the National Institutes of Health confirms that osteoporosis is a massive danger for women after menopause, proving that the vast majority of this severe bone loss is caused entirely by this sudden estrogen crash. However, HRT prevents bone loss by replacing declining estrogen levels, which normally regulate bone breakdown and rebuilding. But that's not all. HRT also suppresses bone reabsorbing cells while supporting bone-forming cells, increasing bone density and reducing fracture risks by roughly 50%.
So what we know in menopause is that, aging combined with menopause, we see a dramatic loss of muscle mass with the menopause process. And so in that first 10 years of menopause, we could lose up to 10, sometimes 15% of our muscle mass. And that muscle mass is going to determine your resistance to sugars. So your insulin resistance is really tied to your muscle mass. Right. Your functionality, your ability to recover from a fall. And the other thing is what most people don't understand is the musculoskeletal unit acts as one. So when we have low muscle mass, you are dramatically increasing your risk of osteoporosis. Now, right now, this might shock you, but 50% of females will have an osteoporotic fracture before they die. And this is almost completely preventable.
As Dr. Mary Claire Haver rightly indicated, if estrogen loss can damage your bones, then your muscles aren't safe either, and here's why. Estrogen helps your muscles repair themselves and maintain their power. When menopause causes estrogen levels to drop, everyday activities like climbing stairs, carrying groceries, or getting up from a chair can start feeling surprisingly difficult. According to research from the National Institutes of Health, muscle weakness associated with aging becomes even worse in women after menopause because estrogen loss reduces both muscle mass and the quality of the muscle that remains. Now it will interest you to know that HRT prevents muscle loss by maintaining lean muscle mass through stimulating muscle protein synthesis, preventing cell death in muscle tissue, and supporting muscle repair and energy. So what type of HRT is right for you? Now that's a conversation only the right doctor can have with you. Here's the problem. Not every doctor is trained in this. For nearly 2 decades, menopause training all but disappeared from medical schools. So if your doctor brushes off your symptoms or seems unsure, it doesn't mean you're overreacting. It might just mean you need a different doctor. The Menopause Society keeps a free directory of certified menopause practitioners at menopause.org. And telehealth platforms like MidiHealth, Evernow, and Alloy now connect you directly with menopause-trained providers. Many even accept insurance. Whichever path you choose, make sure to find a provider who takes your symptoms seriously and is actually current on the science. For over 20 years, women weren't given a choice. Now you have it. If this helped you see menopause and HRT differently, share it with a woman who needs to hear it too. Subscribe for more videos that give you the science your doctor never had time to. See you next week.